Well, hello and welcome again. It's Dr. David Hargroder with the Mini Gastric Bypass. And today we'll be talking about expectations and surprises with the MGB. But first, we're going to wait on Miss Carla Huventhal, my patient care coordinator, to join me. And we'll get started here in just a minute. So let's wait for Carla. If anybody else has any interest in joining in the conversation, all you got to do is just tap on the little icon to request to be in a conversation, and we'll put you on. And maybe you can tell us your own little surprises that you might have experienced after MGB.
Hi
And
there.
there's Miss Carla. How are you?
I'm good. How are you?
Well, I'm doing pretty well, thank you.
Well, how do
Surprise,
we keep doing this? You have blue on, I have blue on.
you know? I can't tell what you have on because your screen is black. It's been that way for the last several times we've done it. And I don't know why, but when I do the final production, you're there, so I don't worry about it.
Okay. Well, then I won't wear lip gloss next week.
Well, maybe not for me, but you might want to do it for the audience. So I'll
Okay.
leave that up to you.
Okay.
So expectations and surprises, huh? How do you want to approach that?
Well, I am sitting here just grinning from ear to ear, thinking of the surprises along the way. But I'll let you start with the expectations for a person who has the mini gastric bypass with us.
Sure. Well, first thing I'll tell you is our average person should expect to lose about 70 to 75% of their excess weight.
Yes.
And that's not to be confused with 70% of your total weight, because that's not exactly the same thing. So if you're calculating it to figure out what that might be, it's you have to figure out, okay, what am I supposed to weigh based on a BMI chart, for example. And the example I like to use, just because the math is real easy, is a person that weighs 200 pounds that is supposed to weigh 100 pounds.
Mm-hmm.
They're 100 pounds overweight. So we would expect them to lose about 70% of that 100 pounds.
Correct.
Which would be 70 pounds, right? So yes. 200 minus 70 is 130. So a 200-pound person would expect to drop down to about 130. And we have this formula we can use. Anybody that wants to know that, us to predict their weight, we're happy to do that. So the amount of weight lost is the important first expectation. And that number, 70 to 75%, is on the high end of pretty much all of the other weight loss operations. Certainly the sleeve and the lat band, the band has like 45 to 50% excess weight loss. Mm-hmm. The sleeve, anywhere from 50 to 65% or so of weight loss. Pretty good, but with the sleeve, you tend to gain it back 3 to 5 years later.
Yes.
And same thing with the lat band. And then you've got others like the Roux-en-Y. They're also about 70%, and the Sadie procedure and the duodenal switch. They're in that 70% range as well. So we're about equivalent or maybe better than most of the other operations that are out there in terms of weight loss. But the other expectations that I really get excited about are all of the health benefits that come with the surgery.
Yes.
Diabetes, for example, it just still amazes me 20-something years later. Been doing this for 22 years now, and it still amazes me how a patient can come to see me for surgery and they're taking insulin, they're on metformin, and like 3 or 4 or 5 different medications to control their diabetes. And then they come into the hospital, have surgery done, 45-minute operation, overnight stay. And when they go home the next day, they go home off all of their diabetes medicine. And about 90% of the time, they're going to be able to stay off of those medicines permanently and never need them again. That, to me, is one of the most astounding statistics that we have.
Yes.
There are similar results with other comorbidities. High blood pressure, for example, about 75% of our patients are able to come off of their blood pressure medicine and stay off of it. And the neat thing is, like with diabetes and high blood pressure, you get off of those medicines the day of surgery. It's not like you get off of them 6 months later after you've lost 50 or 100 pounds.
Right.
The effect happens immediately after the surgery, and you can come off of all of those medicines. Cholesterol gets better. If you have sleep apnea, that gets better. Chronic pain in your hips and your knees and your back,
Yes.
that all gets better. Your overall cardiac function, that is how well your heart is pumping oxygen and nutrients out to the rest of your body, that gets better. And that is something you'll notice within the first week after surgery, where you'll be walking down the hallway, or you'll be walking in your neighborhood, or climbing a flight of stairs, and you'll just stop and realize that I'm not out of breath right now. It's
Right.
kind of a
Right.
subtle thing, you know? It's like you're walking up a flight of stairs that you normally have to stop halfway up because you're out of breath. And you look back and you're like, oh, wait a minute. I just went up that whole flight of stairs and I didn't have to stop and rest, and I'm not out of breath.
Yes.
So these are just some of the many expectations. Those are just like the medical, physical expectations. The other expectations, you're going to have to expect to find yourself with a lot more energy, and you're going to be able to find new opportunities that are going to present themselves in life. It's a sad reality, but obesity is still, you know, a very common socially accepted
Yes.
prejudice. And there are a lot of lost opportunities with jobs, with housing, with just personal relationships and those sort of things.
Yes.
So we also expect all of those things to improve after the surgery as well.
Yes.
Is
Well,
that an
I have
adequate rundown?
I think that's wonderful. And
Uh,
you know, one of the big surprises for me is that I'm going to share with you is when you told me that in my appointment with you the day before surgery, I went back to the car and thought, no, well, I'll settle for a few of them. But I have to tell you, every one of those statements are absolutely true. And that is a surprise. You know, when you have fought your weight for years and years and years, I think one of the biggest surprises that's early on is the rapid weight loss. You know, as everyone knows, I started out weighing 320. My first month, I lost 23 pounds. Was that a surprise? That was mild. But at 3 months, I had lost 50 pounds, and that was a surprise because I had been on regular food for 2 months. But when I lost 100 pounds in 8 months and 10 days, that was beyond a sweet surprise. That was absolutely wonderful. And to lose 159 pounds total in a year and a half was just to me incredible. And you're absolutely right. Along the way, the energy is unbelievable. You know, if you sit down and you really think about what it's like when you have that extra 100 and 150 pounds on your body and you're trying to even live an average life, how tough that is.
yeah.
I mean, really is different. And to shed that feels so different. Another surprise along the way, and maybe you can touch on this, is our taste changes toward food. I came out craving fish and green beans. How do you do that to us? I
Yeah.
did not like fish and green beans.
It is a really interesting phenomenon. And, you know, I honestly don't know the exact mechanism, but I suspect it's a hormonal type thing. But I can't tell you how many patients have told me, you know, I thought you were operating on my stomach, but I feel like you've operated on my brain, because
Yes,
it does actually, for many people, and I would say the majority of people, it
yes,
actually does change your perception of taste. So sweet
Yes.
things taste much, much sweeter after surgery.
Yes.
Uh,
Yes.
and like you said, you know, I just hear it all the time. I used to love A, and now I crave B. You know,
Yes.
I used to love French fries from
Yes.
McDonald's, and now I can't stand them. They just smell like a big pile of burnt oil. And I used to
Yes.
turn my nose up to broccoli and salmon, but now I find myself craving broccoli and salmon. It's a weird phenomenon, interesting. Don't have a good. I probably ought to just go research it a little more myself, and I'll probably find the answer. But it is
But
a phenomenon we've witnessed over and over again.
and it lasts forever. I
Yeah,
mean, it's not like I craved it just during the weight loss time. It's still a craving. I mean, it is. It's a phenomenon that's unexplainable.
yeah,
The other thing you touched on is the prejudices. Now, I wouldn't consider myself, it takes a lot to make me angry. It just does. And, I'm pretty easygoing and I like people and I like hearing about them. But I remember this one incident when Henry and I were entering a restaurant and the man opened the door and held it for me. And evidently, based on Henry's response, I evidently gave him a very dirty look. So when we were seated at the table, Henry says to me, "Why did you look at that man like that?" And I said, What are you talking about?" And I said, "Well, if I weighed 320, he wouldn't have held the door for me." And Henry was like, "Oh my goodness." And it made me aware of that anger that I didn't even know was there. And I have to tell you another story and why I love Kara, your daughter, absolutely amazing. And I know I've told you this story before, but one of our MGB cruises, one of our patients who had just recently had the surgery, but he still weighed in the 400s. He was sitting on the stairs on the cruise ship, and she went up to him and sat next to him and just chatted away. Now, your daughter is absolutely drop dead gorgeous. And he just lit up all over like, oh my gosh. And she treated him like any other person in this world. And that's when I absolutely fell in love with her and know she has a heart of gold.
yes.
And even to this day, it will make me angry to see people who don't recognize people who are either different, overweight, in wheelchairs. Look, we're all humans. And it's sad to see people do that to each other. So, yes, I just love that, seeing that in her. So, yes. And I think my biggest surprise, and probably the last one I'll talk about, is my relationship with me. I didn't know or wasn't as aware that when I looked in the mirror, how I really treated myself and talked to myself. I wouldn't have talked to a stranger like that. And to see myself shrink and yet grow on the inside to become stronger and more confident is just one of the biggest surprises, but one of my greatest rewards of having the MGB
Yeah, yeah.
and losing all of the back pain. I was on muscle relaxers, painkillers for a year, and to be able to shed all that and all that pain be gone was another huge surprise.
And
So I think there's many.
you were expecting to have back surgery, weren't you?
Yes. In fact, they told me I had to have back surgery, but I had to lose weight before I could have the surgery. Well, they kept putting me in bed with pillows under my legs to get the weight off my back, and I would gain more weight. And so it was like a vicious cycle. And so, yes, man, never needed it.
Yeah.
But it took about 80 pounds that I lost before the pain was totally gone. But it was totally gone.
Yay.
Yay. Yeah. And another surprise is enjoying being hugged by anyone. I didn't realize that when people hugged me, I was concerned at how big I felt in their hug.
Hmm.
And that is totally gone,
Yeah.
totally gone. So yes, so I want to hug everybody.
Yeah, this is one of those sessions where I wish we had some real audience participation, because I bet
Yes.
you we could go on and on about the surprises that a lot of our patients have experienced through the years. So
Yes.
it's so much more than just losing weight, and
Yes,
it's
it
so much
is.
more than just about your body image. It is about your overall health
Yes.
and about your mental and emotional health as well, because
Yes,
I
it
think once
is.
you lose the weight, start feeling better physically, it also helps you to feel better mentally, emotionally, and all the way around.
You're alive again, and you're at peace with who you
Yeah,
are. No greater gift. No greater gift. And you know what I love about that is you can only give that to your children if you have that. So that I love the fact that we pass that confidence on to them.
yeah.
Feel better. Yes. That's yes, that's James.
Yeah, I'm reading that too. Feels better, more energetic, not
Yes.
so sluggish. Uh, Good. Look forward to surgery. Excellent, James.
Yes.
We're looking forward to it as well.
Yes.
And then James lost 59% total body weight.
Yes,
So that's really
yes.
good. That's probably more than 70% of excess.
Yes.
So that's
Oops, I
excellent.
missed the next one.
And then Sherry is Sherry Wampler. I remember my son hugging me afterwards and saying, "I can reach all the way around you."
Yes.
And he
Yes.
was a grown man, so that was a nice accomplishment for him.
Yes. Well, if anybody has any questions, please call me at 314-807-7110. Again, 314-807-7110.
Excellent. All right. Well, thank you. Hi to Allie. And if anybody needs to get in touch with us, she is the one to call. Carla will answer her phone.
Yes.
And let's see, are there good results from revisions? Uh, yeah. I mean, we don't do nearly as many revisions. And of course, we only do revisions from either a lap band or a sleeve or an MGB. We don't do revisions from Roux-en-Y's or other things of that sort. Um, and we don't have as big of a pool to get the statistics from. But as a general rule, our revisions, I think, have had very good results. So to answer that question.
And Tanya, I saw you go by, hon. I love you. Call me. I would love to help you. Yay, Tanya.
Excellent. And look, Allie had her surgery with Dr. Rutledge 21 years ago or 20 years ago.
Wow.
And
Yes.
yeah, that's awesome. So, Allie, if you need to give us a call, we'll be happy to visit with you. And just anybody else that needs to learn any more information, the website is just MGB.Surgery.
Yes.
MGB.Surgery. Carla, we'll see you again next week, same time.
You bet. I'll be here.
All right. Y'all have a
All right.
great rest of the week.
Bye-bye.
Thanks. Bye-bye.
Bye-bye.